Sharon Lewin is the director of the Doherty Institute, which produced the official COVID modelling for the federal government and national cabinet. She joins us now. Thank you so much, Sharon, for taking time to speak with us today. There is this insistence now by the state premiers to recognise that if you do not have your booster, then you're not fully immunised. Is that something that you are on board with?
Look, these are difficult decisions. Australia's done incredibly well getting so many people their first 2 doses. At the moment, there's a gap of 5 months to get the 3rd dose. We're going to have to make that really easy for people to access. Certainly, you get much better immunity after your 3rd dose, and you need that 3rd dose for better protection against Omicron. And deciding whether that makes you fully vaccinated or not will be a decision for our national cabinet.
There's also that discussion as to whether the gap between the 2nd dose and the booster shot should be shortened from 5 months to 4 months as well. There's some concern too that those who've had AstraZeneca as their jab, well, their immunity may be waning far earlier. Would you agree that there is a need to shorten that gap between the 2nd dose and the booster shot?
Yeah, to make that decision, the authorities or the advisory group, ATAGI, are weighing up a number of factors. How quickly your antibodies drop, and yes, they do drop. They start lower with AstraZeneca, and therefore they will be lower at 4 months. How much safety data we have at giving the booster earlier, and ability to deliver it. So they're weighing all of these things up. We're certainly learning from overseas that the booster dose gives you that additional protection against Omicron that we want. And so these are difficult decisions being weighed up by all the best evidence available and availability of vaccines. And that may well change. The current recommendation of 5 months may well change in coming days.
All right, so let's just say that gap is shortened. We shorten it from 5 months to 4 months. That would mean that a lot more Australians would need that booster shot quite soon, in fact, immediately. How confident are you that we've actually got the supply?
I understand that there is no problem with supply. The challenge will be about rolling out and getting that into people's arms. I should just say that booster doses are one approach for Omicron. There are other things in the toolbox that we can do now to prevent that massive uptick in cases that we're seeing in many other parts of the world, and that includes simple public health measures.
Speaking of simple public health measures, you are a proponent of mask wearing, particularly indoors at this time when the Omicron cases are rising. Now, the New South Wales Premier has said that his state government would recommend that be done for people to wear masks indoors. They're recommending it, but he says that it is down to personal responsibility. Do you think that after 2 years of a pandemic that we are responsible enough to know what to do and not have it mandated?
Look, in an ideal world, of course, we trust that people will do the right thing. However, rules are changing constantly. People are confused and they want to know what they can and can't do. All along in this pandemic, we have had most of our policies informed by the best science and very clear instructions of what you can and can't do. We're in a position at the moment where days really matter. So having the right policy right now, making it really clear to people what you can and can't do, is something I strongly support. And that includes a simple intervention like mask wearing, which, really we've become very used to. I know it's not the way we like to live, but we have become very used to it. And I think we need our leaders to tell us where we can't wear those masks, because my decision to not wearing a mask doesn't just affect me, it affects everyone around me. And while we have borders open internally with Australia, it affects everyone across Australia. So we really need some cohesion and simple advice to stop any confusion for people of what they can and can't do.
All right, Sharon Lewin, the director of the Doherty Institute. Thank you.
Thanks very much.